So this one is test 2 from the classroom. And if you see the first question, it says the main point of the memo is. So in the strategy session, we learned that if it is a memo, most of the time the purpose would not be to inform a new guideline or a new policy. It would be always uh, in connection with existing guidelines, right? It would be mainly written because the staff probably would be failing, or there would be lower compliance to the guidelines. So here it says the main point of the memo is. Now we learned that we ask ourselves 3 questions. Okay, first is what I have to do. Do I have to read for main idea? Do I have to read for a specific detail? Or do I have to read for purpose? So here it says the main point of the memo. So I get to know that I have to read for main idea. Okay. Then while reading the paragraph, I keep 2 questions in mind. Who is it for? And why is it written? So who is it for? This is to be answered in 2 ways. Which group of staff and which group of patient? Because some guidelines would have some exceptions. Some guidelines will be specifically written for a certain category of patient, and therefore it is a very important consideration that you have to have. So here it says that it is written for all staff. And what is it about? Concerning handheld devices. And the third question you ask yourself is, why is it written? What is the staff supposed to do after receiving such a memo? Okay. So with that, you read the whole paragraph. So you don't read the answer choices, you read the question. After reading the question, once you understand what you have to read for, you do go directly to the paragraph and you read the paragraph with these 2 questions in mind. Who is it for and why is it written? So simultaneously you would try and understand both the things. So see here in the beginning itself, it says this memorandum is a reminder to all staff. So we got the answer. Why is it written? It is written to remind them, with staff, all the staff, of the rules governing the use of handheld devices within the hospital. So it is not limited to a particular area, but the whole hospital. What is it saying? Never to be used. Okay. If they are needed, there is an exception. They are, first of all, they are never to be used. Personal devices are never to be used. If at all you need images, then that is to be taken only with the hospital's equipment. And those images are the sole property of healthcare facility. And again, here you can see that is prohibited. So all the guidelines here are very strict guidelines. There are no exceptions as such in terms of the use of personal devices. The only exception that is mentioned here is that it can be used only during the breaks. And the policy has to be followed, otherwise it will lead to disciplinary action. So we get the idea that this is a reminder. The hospital already has a policy that people are not, or the staff members are not able to, or not allowed to use any personal devices for recording images or videos. If at all they need to do so, they should be using hospital equipment provided by the hospital, and they cannot use it anywhere. It is strictly prohibited. So here if you go to the answer choice, right, look at C, inform staff of a new set of procedure. So see, instead of reading the whole paragraph all over again, if you read with this specific questions in your mind, it would become very easy for you to rule out those answer choices. Because why is it written? It is written to remind the staff, not to inform them. So this straight away helps you to rule out C. Now you have A and B with you. Now A specifies the right of patients. The paragraph, however, does not specifically talk about patients' right. It talks about the rules that healthcare professionals have to follow. So that is why conform details of hospital policy. Why the verb conform is used here is because the policy is already in existence. It is not a new policy that is being introduced. The existing policy is being, the staff are being reminded of the existing policy. That is why the word conform is used here, right? So now for the remaining 5 questions, what I would be doing is I would be getting the task on screen and I would be giving you 2 minutes time for each question. Make sure that you have to use less than 2 minutes, ideally 1.5 minutes for each question. Try not to read the paragraph all over again. Do not do so. If you will read it carefully in the very first attempt with these questions, then you would not need to read it all over again. Right? So remind yourself to utilize the strategies that you have learned. So I'm getting question 2 on screen, and as the alarm sounds, I'll move on to the next question. So question 2 you have, and 2 minutes time. make a little change. Yeah, go ahead. Next one. Okay. And the final question now. Okay, that's 2 minutes. Okay, so now let us look at the answers. Okay, let me know what have you all selected for number 2. Okay, so for 2, I see a lot of C's here. Yeah, and that is correct as well, because it does inform you that they are harmful for both staff, visitors, as well as the patient. That is paramount. Patient should not have access, and it doesn't tell you anything about what to do with them. So confiscated means how they should be discarded. Okay, so nothing has been given about what is to be done once they have been found, and that is why B is wrong, and A is wrong because of the blanket word only, can only be carried out, whereas the paragraph says that it has to be carried out, but it is to be carried out in a way where it doesn't lead to any conflict of interest, or it doesn't lead to any conflicting situation. So yeah, it's good that all of you could get it correct. Very good. Now, third one. Okay, tell me what answer have you all selected here for third one? Mm-hmm. Okay, so I mainly see A and B here. Mhm. Okay, so see, we discussed one more strategy while we discussed reading part B strategy. That was exception. Yeah, we learned that we should also be careful about any exceptions that are given. And there is a difference between must and should. So here it says should occur, so that is a recommendation, but there is exception as well. If this is not appropriate, then it can also take place outside the patient room. So that helps me to rule out A, isn't it? Because A says it should take place at the bedside. Is that the main message being conveyed here? No. The main, the whole paragraph is not just about the place. Why is it written? It is to say, how the notes are to be taken. It is to say how the family, the communication with the family members is to be done, and how parents are to be involved. Here it is given if parents are available, they should be encouraged to participate. Or if they are not available, that is other exception you have. So one is that they are encouraged, but there is also an exception. It is not that the parents must always be present, right? So that is also an exception that is given here. So that is why B is the correct answer here. Parents need to be involved or fully informed. So if they are available, they are to be involved. If they are not available, at least they must be informed. And when it comes to making notes, there is no exception there. Yeah. Here it says either in electronic or handwritten form, whereas here it is given must be completed in SBAR format utilizing the EMR. So it is must. There is no exception there. So those are the, you know, strategies which you need to follow. And if you follow them, 100% of the time you would be able to get correct answer. If you would miss any of these steps, there are chances that you may at times end up getting wrong answer. So I would again encourage all of you to stick to those strategies. It would also reduce your time significantly. Okay. For fourth one, what have you all chosen? For fourth one. Yeah, a lot of C's here and A's. Okay. Mhm. Yeah. Okay. So see, why is it written? So here it says it is a memo due to a recent incident. So there has been a recent accident which has led to injury. That is why this is written. And then the paragraph also talks about what is entrapment. It explains what kind of injuries or complications can happen because of that. But what is the ultimate purpose? Why it is written or what the staff is supposed to do after receiving it? That is given here. Encourages a review of practices for initiating the rule, the use, okay, and each patient to be assessed individually. So when I ask, myself, who is it for? So here there is this phrase which says greatest risk of harm. But when I say greatest risk of harm, does it mean that rest of the patients are not at harm? No. This kind of phrases would always confuse you. You might think that it is only for these patients, cognitively impaired, low body weight, or those who have uncontrolled movements. No, they are at the greatest risk. The others are also at risk, but these patients are at the greatest risk. So be very, very careful about these type of sentences, particularly when it says that, particularly children would need this assessment. So particularly children would need it means other people would also need, but children would need it specifically. Similarly, here the greatest risk doesn't mean that only these people are at risk. So this entire paragraph is not written only for a specific kind of patients. Okay? And that helps me to um, rule out both B and A. Only do so if patient can be monitored closely. The paragraph doesn't say whether to use it or not. Okay? It doesn't say whether to use it or not. So again, when we were discussing strategies, we did it. Yeah? Why is it written? How to do it? When to do it? Why to do it? So here it doesn't say when to do it. It says how to do it. How to do it? Before using, you need to carry out an individual assessment. So C is the correct answer here. Evaluate the needs of patients on a case by case basis, because here also it says each patient be assessed individually before using the bed rails. That is the main message that is being conveyed. And option B goes into extreme negative. Avoid using them until. So we discussed this strategy as well. While looking at answer choices, you should pay attention to blanket words. So only do so is a blanket word, which means that only in this circumstance you should do it. Until is it goes in extreme negative, that you should do it only if it is absolutely necessary. That is why both those options are wrong, because paragraph is not mainly about when to do it. It is mainly about how to do it and why to do it, probably, because it also tells you about the complications that can occur. Okay, for fifth one, what have you all selected for fifth one? How about others? What have you all selected for fifth question? Have you not selected any? Couldn't you complete this within that 2 minutes time? Okay, okay. So I have got answers for only three of you, which means three of you couldn't do it within the time frame. A is the answer that all of you have selected, and that's the correct answer. Okay. So again here, if we consider who is it for, so it is given that from the staff members' perspective, it is those who are involved in PCA, patient controlled analgesia. For which group of patient? Those who are over age of 7 and who use PCA pump for pain relief. And here it says that most children, they can use it provided that they understand the concept of self administration. That's an important point, and that is why all the points are saying anesthetist will discuss, okay, nurses repeat this instruction. Then what is to be told to children? Children should not be told certain things. Children should be aware of certain things. So mainly it is explaining how to educate. The topic is also about PCA education. And it also says that they shouldn't be told about, uh, they shouldn't be told that, it will give a complete pain relief. So that is a limitation. So understand its aims, that it helps avoid getting too much of medication, and it also, we should also explain the limitations, that it may not give complete pain relief, but it would reduce the pain level and make them feel comfortable. So mainly it is telling the staff members what to tell to the, or how to educate the children who are going to receive patient controlled analgesia. Nothing about family members as such is given. And again, it doesn't guide you what to do in case of misuse. So report any instances of misuse to the appropriate staff member, but it doesn't tell you anything about the misuse as such. Okay, and in sixth one, what have you all selected? Okay, so a lot of A's and B's. Mhm. Yeah, okay. So let's see. Uh, who is it for, right? So when I answer this question, who is it for? It is for local GPs. This is written for local GPs. Which group of patients? A specific group of patients, because it says that only with those who have acutely painful joints, particularly after a post-operative or during post-operative period. So after the operation, within 30 days, if they develop any of these problems, then they are to be referred to this specific clinic. So it is only for a specific category of patient, and therefore A is the correct answer here, that they meet certain criteria, right? Why not B? Because this is written for GP. A GP wishing to refer patients to the RAOC should, if I say, now see, this is a sentence completion task, isn't it? So if I read it like this, a GP wishing to refer patients to the RAOC should advise them. So them here becomes patients, to contact the clinic directly. So is the GP supposed to tell the patients to contact the contact the hospital directly? No, it is clearly given here that they are accepted from GPs. So only GPs can make referral. There is no exception given here. It doesn't say that patients can directly contact them. Alternatively, they can contact directly. No, it is taken from GP, and it is only for a specific category of patient. And about the appointment, it doesn't say on which day, it just says that a next available appointment will be given to them. So C can be easily ruled out. A, if you will read the B, if you will read the whole sentence, you will understand why it is wrong. So also do so. If you have this kind of questions which are incomplete sentences and you need to complete them, then read the question and answer together. A GP wishing to refer patients to the RAOC should advise them to contact the clinic directly? No. The reference is to be made through GP. They cannot contact directly. That is why again here it says GPs can refer patients directly to the RAOs rather than going through the emergency department. But patients cannot contact them directly, right? And it is for a specific category of patient. That is why meet certain criteria. This is again typical of reading part B, where you know paraphrasing would be there. Certain, specific, a problem, a benefit, a drawback, using generalized kind of language. Okay, so now let me know how many of your answers were correct out of 5 that you all did.